Sickle Cell Plus.
Okay, I think we're going live on YouTube.
Okay.
And then okay, yes, we are live on YouTube. Now I'm
Okay.
gonna go live on Insta.
Hi, everybody.
Hello. I was told last week that y'all could hear my typing, so I put my phone on a tripod this time. So hopefully that makes things a little bit easier. Hi, hello, Instagram. Hello, YouTube. I'm pulling out the YouTube tab right now, so I keep eyes
Let me.
on YouTube and any questions that come in on YouTube. Hi, everyone. How are you? Happy Friday.
Here we are.
We're here, and we'll wait
And
for Dr. Q to send a request and get
I
started. If you already have a question,
I don't
feel
see
free
the
to go ahead and
live.
put in.
I don't see the live coming up on my sickle cell one
Oh,
on
you want
mine.
to, I'm
Maybe
talking to Dr.
I'll
Key.
wait.
You
There
want
we
to
go. There we
scroll
go.
down?
There. I got it. I
You
got
got
it.
it? Okay.
Yeah. I
Perfect.
um
Hi, guys. Where are you guys tuning in from?
okay, I sent you a request.
I want to see where you guys are from. All right. And we'll go ahead and add Dr. Q in. And I already
Uh,
see our first question.
Okay, we're on.
There's Dr.
Jamaica,
Q.
Ghana, wow, UK. This is a international day. Nigeria, wow.
Oof. All right. Ghana.
Dubai.
Hey. Nigeria. Hey. All right, so we got
Oh,
Africa in the house here. West Africa. Oh, we got Dubai. We got Northern
Northern
Virginia.
Virginia.
Awesome. Awesome. All right, so I saw our first question. Does sickle cell affect your vision?
Yes, it can affect your vision. Um, Everybody with sickle cell disease could get what's called retinopathy, where the back of the eye, where you see, has lots of little blood vessels, and if they get damaged, then your those blood there's an area back there that doesn't have oxygen, so the the blood supply tries to go up and come down into that area where there's no oxygen. And while they're there, it's called sea fanning, and they're very friable and they can bleed. It's called retinopathy. If they bleed, then there's like a clot. When that clot retracts, it can actually pull the back of your eye, the retina, off of the eyeball, and that can lead to blindness. So what everybody needs to do is see an ophthalmologist at least once a year to make sure that everything is okay, particularly if you have SC disease. So SC disease has the highest incidence of retinopathy, maybe because their hemoglobin's higher. I'm not sure. Well, I certainly don't know, but I'm not sure if anybody knows why SC, but it's probably their hemoglobin is higher than other people with sickle cell disease. So yeah, and anybody's susceptible. Probably S beta plus thou may not be as susceptible, but every other type of sickle cell disease could have retinopathy, and it's painless. You don't know you have retinopathy unless somebody looks into your eye and tells you you do. If you ever see any like little floaters, black things floating in front of your vision, or you notice that on your vision on one side is not as clear as on the other side, then that's really actually an emergency. You need to have that checked out as soon as you can before it gets worse.
So yes, sickle cell can affect your vision. I actually got diagnosed with sickle cell retinopathy last year. And the way the signs for me having retinopathy was I would see like my pulse in my eye. And this might not be the same thing for everybody, but I would just see like I could count my heartbeat and it's like this overlay in my eye. And I told Dr. King, he's like, get your eyes checked. And,
You know what you could probably see if there was a vessel off your that came off like this and it's got blood and it's pulsating like that, you probably could see that vessel.
I never thought about that.
Yeah.
Yeah, that's probably
It's
what
like,
it is. Um, so yes, please go see an ophthalmologist once a
yeah.
year. I skipped my 1 year and ended up with retinopathy. So, and you guys, you do not want to get that surgery. That laser surgery is horrible. It's so painful. So painful. I cried like a baby on during the surgery, and I had to ask for permission to cry because like tears are already welling up in my eyes. Like, I don't want to ruin what you just did with my eye, but can I cry? Because it hurts so badly. So it's not worth it. Go see
Yeah.
the ophthalmologist every year, once a year, or a retinologist. Um, this is a great question that I got here uh from Dubai. Should we get any stroke screening, such as TCDs, as adults with sickle cell disease? So we get these screenings as kids. What
Hmm.
about as an adult? Why isn't that pushed on?
Well, you can do a TCD in a child because their skull is thin. And so it's ultrasound. So the ultrasound waves, the sound waves from the ultrasound, has to be able to go through your bone and visualize the vessels. Well, they don't visualize the vessels, but to measure the velocity of the blood in your vessels. So in order to do for adults, their skull is just a little too thick to get a very good reading or any reading
Mm.
with the TCD. There, you know, there really isn't a good screening test. The one that if you had any issues, um, people would do an MRI in an adult. Some people feel like kids should get MRIs to detect what's called silent infarcts or teeny tiny little infarcts that you don't notice but can cause problems if you get enough of them.
So TCDs don't typically work in adults because we have too much skull.
Yeah, their skull is. That's why they say it's from around 2 or so until 16. Once you get to be a little
Okay.
older, the stroke risk uh, isn't it's less than when you're younger, but you're still your risk for stroke goes for the rest of your life, really.
All right. All right. Hopefully that answers your question. It's a good one. I mean, it doesn't mean that we need to stop looking, right? Or stop screening for these things, right? It's just screening in a different way.
Yeah. And the other thing, since we're talking about the brain, is if you ever have hi Zara, if you ever have a really severe
Hello.
headache that's like the worst
I'm
headache you've
gonna
ever
answer
had
your
in your
question
life,
in a second, okay?
and especially if there's vomiting involved in it, that could be an intracranial hemorrhage, which is also a real emergency. And they
Wait.
do tend to occur in people who have sickle cell disease.
All right. I have a special guest here. This is my daughter, Zara, and she is going to answer the next question. Can someone with sickle cell disease have kids? Yes, they do. Yes. And how old are you? I'm 10 and a half. 10 and a half? Okay. So hopefully that answers your question. People with sickle cell disease, I have sickle cell disease, type SS, and that's my daughter Zara.
So as you can see, you have very cute kids when you have sickle cell disease.
Oh my gosh. It's a common misconception, right? And pregnancy doesn't look the same for everybody. With sickle cell disease, there are people who have a complex health history that could play into their pregnancy. My health history, I didn't get sick very often. I didn't get hospitalized often, right? And so my pregnancy actually went really well up until 37 weeks where I developed preeclampsia. But I got transfused only once and I was pretty healthy when I was pregnant with Zara. But my sister, for example, who also has SS, she had a difficult pregnancy and she was hospitalized a lot. And when you hospitalized and for pain, then comes a conversation. What medication are we giving? Because whatever we give to you can affect the baby, and so on and so forth. So there's a lot to think about. It's not so cut and dry. The simple answer to the question is yes, people with sickle cell disease can have babies or can have kids. That's the simple answer, but if you want to have a conversation about it, there's a lot to look at. There's a lot to consider, even more so than, people who are just family planning without a chronic illness. Because that pregnancy can put you in danger. The pregnancy can, make you more sick. There's a lot of things that can happen that need to be considered if you are thinking about having a child with sickle cell or having a child while having, sickle cell disease.
And there are high risk OBGYNs who specialize in women who have high risk for a lot of different diseases. And also the hospital should have somewhere you should be able to take care of you and also your baby. So there should be a neonatal intensive care unit there as well, just to be on the safe side.
All right. Hopefully that answers your question because a lot of people don't know or think they cannot have children. It's possible, but it needs to be handled with the utmost care, um, if that's something you're considering. Um, is AVN common in knees? I'm scheduled to have a total knee replacement in October. I have SS, by the way.
So every joint, all the major joints in your, but usually it's your hips. That's what you hear about. It's because it's more common in your hips because you put a lot of weight on your hips. Um, they're very weight bearing, and they also have a very sort of tenuous blood supply. So if that blood supply gets interrupted, then the bone gets damaged, and you end up having AVN. But yes, you can have AVN in your hips, your shoulders. I'm trying to think if I've ever known of anyone who has AV in another joint. I can't think about like I don't, that usually weight bearing or um, joints that undergo a lot of stress. Those are the joints that you could have AV in. And it is very common. I'm just
Yeah.
What I recall is about it happens in maybe 20% of people who have sickle cell disease, which is
AVN or
yeah,
AVN in the knees?
no, AVN, just
Okay.
overall. So it's very common. And the other thing about AVN is a joint replacement can be done even if for some reason you kind of put it off and keep saying, I'm not going to get surgery. I'm not going to get surgery. It can actually be done even if you have pretty severe AVN. That's not contraindication to getting a hip replacement or a knee replacement.
Yeah, so I've seen AVN happen in hips, knees, shoulders. So, as Dr. Q said, joints, keeping up with your joints and, reporting any pain that you might have, especially if it's like, pain that's over a long period of time, because that could be indicative of AVN within your joints.
And there was a paper quite a while ago that showed that you could delay surgery with physical therapy, but eventually you would need to have surgery for your ABN. The physical therapy will decrease the pain, um, but it usually does not uh, prevent you from having ABN. It doesn't prevent it from progressing.
All right, from Nigeria, what can be done when going through a crisis?
Well, you could a crisis, I'm assuming, is a pain crisis. Um, so, you can try to treat it at home. I think the vast majority of people who have sickle cell disease usually have pain for days before they go to the hospital, unless it's really severe. So I think you treat it at home with non-steroidals like ibuprofen and opioids like um, whatever codeine, whatever you happen
I think
to,
that's why they said they're in Nigeria, because that's something they may not have access to,
what, pay
like the
opioids?
opioids at home. And
Yeah. If the I um, Cassandra and I know a lady who's about my age who back in the day, so she's like 75, 70, somewhere between 75, 78. And when she was a little girl, nobody that was a long time ago, and people just didn't think about sickle cell disease. And she recalls her grandmother when she was having pain, they thought she had arthritis or something as a child. She would give her massages, she would put oil on her joints for wherever it hurt, and she would massage her. They'd drink a lot of water. Um, and those are really the distraction sometimes works, but Cassandra would have to tell you because I can't even imagine what it's like to have a really bad pain episode with sickle cell disease.
yeah, in Nigeria. And I can speak to that because I am Nigerian and I went to Nigeria and I was in pain in Nigeria and went to the ER and got very little pain medication. And so I don't think it's anything that we have an answer for, and it's so unfortunate. You know, we know what that course of action could look like here in the US, but in Nigeria, where regulations are different, it's really tough. And my experience, particularly in Nigeria, wasn't a great one when I had a pain crisis. And so you have to look for alternative ways to treat pain, right? Yeah, of course, taking whatever pain medication you have to try and alleviate that. But then also, people talk about taking a hot shower or having a heating pad or a hot water bottle to at least make you a little bit more comfortable. Um, Massages, there's something called distraction therapy where, when you're in pain, you're, you scrolling through TikTok or, trying to get your mind off of it. Have I mastered that? Not like if I'm in a pain crisis and there's no way I can pay attention to TikTok. Like there's no way. So distraction therapy wouldn't work for me. So um, that's really something that you should discuss with your provider on what can happen and what options you have so that when you are in pain, you have a plan of action for that, especially within Nigeria. Unfortunately, just a lot of the time they don't give pain medication. Can y'all imagine not having pain medication for your sickle cell crisis? Um, and there's actually conversations surrounding that. Like, how are sickle cell patients able to endure pain in Nigeria and all these places where, opioid use is lower versus here in the US. And a lot of people say that's actually the better way, right? And there's back and forth with that, whether giving pain medication, giving opioids is actually better or worse for, people living with sickle cell. But there isn't an answer, unfortunately, for that and dealing with pain, unfortunately. And I'm so sorry that you're going through that pain right now. And I just hope you can manage to the best of your ability. Yeah, and I'm reading some of the responses. We need to support the countries that lack regulation support, like Nigeria. Absolutely. Um, but yeah, that's a tough one. That's a tough one. But I hope your pain isn't, you know, too long and you are able to get through it. And I'm sending good thoughts and positivity and thoughts of healing. So um, hopefully you find some comfort in the best way that you can. I have a next question here. Is it a must for sickle cell disease to use hydroxyurea?
Nothing's a must.
Yeah.
But hydroxyurea will definitely decrease pain, what we were just talking about. It can increase your hemoglobin. Um, it increases your fetal hemoglobin so that you have organ protection. So what Cassandra, if you've watched this before, what Cassandra will tell you is that she still has pain, but she takes hydroxyurea because overall, people who take hydroxyurea, and this has been available for decades in this country, and people have been tracked from the original studies to see how they do. And a kind of an overview study showed that people, even if they didn't take hydroxyurea for a prolonged period of time, like years and years, anybody who took hydroxyurea for a year or two and then for whatever reason stopped taking it, their life expectancy was longer than people who never took hydroxyurea. So it needs to be monitored by somebody who knows about hydroxyurea, a doctor who knows about hydroxyurea, what to look for in your CBC, your complete blood count, to make sure that that everything is normal. Your dose may have to be adjusted a little bit once you start taking it. Sometimes it has to be stopped if your hemoglobin goes down or your platelets go down. But in my experience, I usually would wait a few weeks, maybe 2 or 3 weeks, restart the hydroxyurea, and that problem did not reoccur. So things like little viral infections and stuff can affect your bone marrow, and maybe with I don't, I'm just guessing, but maybe with hydroxyurea that effect is a little more noticeable. But you do have to be monitored if you're on hydroxyurea. I was just on a um, call that surprised me because I didn't know this. I knew that voxelotor had been taken off the market. I knew that there was a study with crizolizumab that didn't support it very well. Um, and I always thought L-glutamine was kind of a good drug because it was an amino acid. But in Europe, in the EU, none of those drugs are. approved. So in Europe, the only drug that's approved for sickle cell disease, I imagine, is hydroxyurea. So that, I guess it underlines the fact that hydroxyurea is perhaps one of the only drugs you're available, but it is definitely a medication that can change your life with sickle cell disease and help you live longer. So nothing, you don't have to do anything, but if you want to have less pain, higher hemoglobin, live longer, then hydroxyurea is for you.
Yeah, I was at a meeting last week in which Dr. Wally Smith was talking about hydroxyurea. And what's so special about hydroxyurea is that it has five mechanisms of action. Five. So, and I'm not sure what those five are. Maybe Dr. Key, you know better than I do, but one of them is increasing fetal hemoglobin. I don't know who the other four are, right? But um, to say that a medication can work to improve your sickle cell in five different ways is a huge deal. A lot of the drugs that are being currently developed right now only have one mechanism of action. They're only targeting one problem for sickle cell. And hydroxyurea has been studied the longest within sickle cell. It's been studied for decades now. So, if we're never going to tell you to do what what you should do, right? Just recommend or at least just have all the information. But just know that hydroxyurea works on sickle cell in multiple ways, whereas a lot of what's being developed right now only targets one way. So, for example, Dr. Key was talking about crizolizumab. It only targets adhesion, so that stickiness, the p-selectin within your blood that causes the stickiness um, during a vasal occlusion or during a pain crisis. Voxelotor, they and I don't want to get like super technical, but they have the one mechanism of action. This is the Oxbryta, which is to raise your hemoglobin. Um, and so just understanding, how hydroxyurea works and how people um, just understanding the benefits of hydroxyurea is going to be important in your decision making. And also, hydroxyurea, it's kind of like that super medication for sickle cell because it improves sickle cell in multiple ways. The reason I got on hydroxyurea is because I wanted to live longer. And that's
That's a pretty good reason.
you guys saw my daughter. I got to be around for her. Like, who's going to discipline her? Who's going to, do her hair? Um, so
That's
I have to be around to scold her and to hug her and so on and so forth. And so that was the reason why I started taking hydroxy. I didn't take hydroxyurea because I was in pain or because I wanted to lower my pain. What sold me was that it decreases my mortality and it protects my organs. And so those are the two main reasons why I started taking hydroxyurea. So also, you have to think about what you want to improve with sickle cell for you, right? Like what's important to you. Maybe you can handle the pain, or maybe you can handle, less, it's having all that information is extremely important at the end of the day. So, that's starting hydroxyurea was I wanted to be around longer for my daughter.
Yeah, Wally Smith is a very special guy. He's one of the real leading people who advocate for sickle cell disease. He's a hematologist. Let me think if I can think of five things. I don't know if I can.
The five
I
mechanisms, and this is
I
what this
can't
is
really
coming from
compete.
Wally. Yeah,
I can't
yeah.
compete with him. But let's think about it. So it increases your fetal hemoglobin, and fetal hemoglobin interferes with sickling. So that's why um, your hemoglobin goes up is because you interfere with sickling, and so it makes your red blood cells last longer. It also decreases your white blood cell count. White blood cells are very, very sticky, and they participate in vaso-occlusion. And for whatever reason, probably because of inflammation, people with sickle cell disease tend to have a above average white count. And what hydroxyurea does is lower your white count to the normal level. It doesn't make your white count so low that it's a It can. That's why you got to be checked now and then. But it lowers your white count, which also decreases your vaso-occlusion. I don't know if I can think of five. The
That's what he
other thing
said.
is, the other thing is, hydroxyurea is an NO donor. So that NO is something that causes vasodilatation. And so there's another reason that it's helpful. So that's only three.
Is there anything with nitric oxide at all?
Yeah, that's it. The NO is
Oh,
nitric
is it
oxide.
that's the
Yeah.
NO.
I'm
Okay.
just trying to think of the two more. God, Wally, where are you?
Yeah, maybe we'll have to have him online. I just quickly asked ChatGPT, and it says increase fetal hemoglobin
Right.
production, reduces white blood cell count,
Yeah.
decreases red cell adhesion,
Yeah.
improves red cell hydration and deformability,
Mhm. Right.
and then increases nitric oxide production. So those are the
Right.
five.
Right. Right.
So there's the five ways that hydroxyurea
Yeah.
improves sickle cell.
And
Um,
just by having fetal hemoglobin and decreasing the polymerization of the hemoglobin in your red cell, that prevents hemolysis. It just makes your red cells much healthier. So
all right, I have a follow-up hydroxyurea question before I move on to the next one about infections. Does hydroxyurea ever stop working? And if so, what do we do?
it shouldn't. It hydroxyurea does not appear. I have never seen a person with sickle cell who took hydroxyurea and it didn't work. If they were taking it the way they were
Well,
supposed
like
to.
stopped working after working for years. I've seen
Right.
stories of it stopped working for people.
Yeah, it could be that I think what you really have to do is if you're on hydroxyurea, need to be monitored. The dose may need to be changed. So they
Mm,
have what's
yeah,
called the maximum tolerated dose, which is the highest dose that you can take without severely decreasing your white count or your red count. So
yeah,
that dose, it's pretty high. I didn't see a lot of people who could have that kids anyway who could tolerate that high a dose. But if it stops working, I would definitely have a hematologist figure out if there was an issue about the dosing or something else, some other reason. It does not work in every single person. So some people, less than 5% of people who are on it, initially, it just does not work for them.
yeah,
Uh, and you change your whole body changes over your lifetime. So I know someone who's in their 70s who takes it and it works for them, but um, everybody's different. So you can't tell why it would work better for someone than for someone else, or not
yeah.
work at all for somebody.
I always have infections. Is there a way I can prevent infections because infections trigger crisis?
Right. Well, infections aren't good, period.
Yeah.
Um, they cause, the increased inflammation. So maybe that's probably why this person has pain episodes when has an infection because it increases inflammation, which, kind of snowballs into a pain episode. I think what you need to do is I don't know what kind of infection you have, but you need little kids uh, take penicillin every day for to prevent really serious life-threatening infections. And depending on what your infection is, you could talk to your hematologist and figure out what would be the correct treatment to prevent infections. What one of the problems with some, if it's an antibiotic you need to take, is bacteria um, they and viruses, they mutate a lot. Like in COVID, you've read about every year or so, you need to get a new COVID shot because the COVID's a little bit different than it was 2 years ago. And that happens to viruses and to bacteria. So depending on what kind of um, infection you have, giving antibiotics for a bacterial infection will force that bacteria to change, and the ones that are less susceptible will increase, and then that antibiotic doesn't work for you anymore. So there are some downsides to um, taking medication for infections prophylactically. Although giving children penicillin to prevent pneumococcal infections does not seem to do that. It's a interesting fact. You would think that at some point the bacteria would be well because you're not infected all the time, so it just prevents the infection. It slows down the infection if you get it. It does not cure uh, the pneumococcal or other infection that you might get. It just slows it down so you have enough time to get to the emergency room and get the definitive treatment for whatever infection it is that you have.
All right, guys, I'm just getting to your follow-up questions about hydroxyurea. These are all really great questions. Um, but there was a question before we get to that, there's a question, is it necessary for people with sickle cell to get vaccinations?
Absolutely. Um, Vaccinations are really important for everybody, but particularly for people who have sickle cell disease, because you some infections, like measles, will make you more susceptible to bacterial infections and other kinds of infections. While you have the infection itself, it makes you really sick. And with people with sickle cell disease, could it develop acute chest syndrome or other complications during an infection? So what you want to do is try to make yourself as healthy as possible, and immunizations are one way to do that. So most people in this country, in the United States, are vaccinated in their childhood. And most of those, or many of those vaccines, they give lifelong protection. So yeah, they're very, very, very important. Uh, the human papillomavirus vaccine is really important for everybody, but people with sickle cell disease as well, because it prevents cervical cancer. Um, and both men and women should get that vaccine.
Um, yeah, and I feel like vaccines kind of conversations changed after the COVID-19 vaccine, right? And people are grouping all vaccinations with the COVID-19 and whatever came with that. But people have been getting vaccinated with sickle cell before the COVID-19 vaccine. Um, I got vaccinated as a child, and the way I think about vaccinations are they're another form of protection or another medicine that's protecting me. The same way I take antibiotics if I don't want to get an infection or if I want to kill an infection. That's what a vaccine is or a vaccination is. And so that's how I organize it in my brain. Um, so yeah, that's it's always a recommendation from providers to get vaccinated to add that extra protection um, for those living with sickle cell, especially when we're immunocompromised and have all the other stuff that we're dealing with.
And I'm old enough to remember when people there weren't a lot of vaccines. And the one thing that sticks in my mind was in the 1950s when I was like, I can't remember what grade I was in, but the polio vaccine came out, and it was a pink liquid that they put a couple drops of it on a sugar cube. And at school,
Wow.
yeah, at school, every single kid would line up and go through the auditorium, and there were nurses putting these little sugar cubes out, and everybody popped them into their mouth and took them. And the parents were ecstatic because polio causes a lot of really serious problems. Um, there were actually like polio hospitals where children, a whole ward of kids would be on ventilators because they couldn't breathe secondary to polio. And or they would and then a lot of kids would have paralysis in their arms or their legs secondary to polio. It was a big deal. And when that vaccine came out, people were just really um, adamant about having kids vaccinated. And I think because of that, that was so successful, it really in people in my generation uh, were very, very thankful that we had vaccines for all these infectious diseases. I mean, I can remember I had measles, I had mumps, I had all those, and you were pretty, and chicken pox. I was lucky that I didn't get that sick. Measles can make you really sick, and I was lucky that I didn't get very sick with it.
Okay. And then the follow-up to that, is it too late to take on an HPV vaccine after having a positive HPV 66 with sickle cell?
Yes, it's
It's
anybody
too late.
who, there are many different, um, just like we were talking about with uh, uh, COVID and there are many different types of HPV. And the vaccine protects you against the types that can cause cancer as well as some other ones. So it's not, HPV isn't like one thing, it's a variety of similar, they're all called HPV, but they're all a little bit different. And in the vaccine, you get protected against the main viruses that can cause cervical cancer. And if you're a partner, and HPV is common, it's like it is the most common sexually transmit. Well, as far as I know, it's the most common. I don't know the true, but if your partner doesn't have HPV and they get their chances of having prostate cancer from HPV are twice what would be considered normal. So even men can get cancer secondary to HPV. It's a lot less common than for women, but it still happens. And in my I've had experience with friends and relatives who've had cervical cancer, and it's not something you want to have, period.
Okay. So I told you guys I would follow up on some of these hydroxyurea questions that you have. Somebody said, but the side effects of hydroxyurea is too much. Is there any other alternative? I'd be interested in understanding what those side effects are for you. The side effects that I understand from hydroxyurea is the hair loss and the blackening of the fingernails. Um, it does also lower sperm count, but that doesn't make you infertile. It just means there's less sperm within a sample size or less sperm. But it only takes one sperm to, you know, do its job, right? So even if you have less, that doesn't make you infertile. Um, Dr. Q, what do you think?
No,
Side
I
effects.
mean, those are the side effects that most people think about. Um, there could be so I don't know what your side effects are, but there are, it's a medication, and some people have
Yeah,
allergies to medication or whatever. But overall, um, the side effects, besides what Cassandra was talking about, are have to do with your blood counts, and that's why you need to have your
yeah.
blood counts checked, and you need to be on the right dose. If you're say for instance, if your white count is starting to go up while you're on hydroxyurea, then you might your physician, your primary care provider might think, well, maybe we could increase this dose a little bit. If it's too low, they might say, maybe we should decrease the dose just a little bit. And I think you can't really go on by one complete blood count unless it's really off the hook. But usually you want to check it again if there's just a mild something lower than it usually is. But I can't think of any besides allergic or some other very unusual side effect that would um, cause you problems with hydroxyurea. And the sperm count that goes down goes right back up once you start it. So,
Once
or
you
stop
stop.
it, stop it,
Yeah.
I mean. So it's not recommended that men or women be on hydroxyurea if they're planning a pregnancy. So if you are planning a pregnancy and you stop your hydroxyurea, then your sperm count is going to go up and you're more likely to conceive. So, um, there's downsides to everything in medicine. There's side effects that we don't expect, but hydroxyurea is very, very safe.
And I just want to share, my dose of hydroxyurea has not been the same since I've started it. So I started off with, 3 capsules a day, and right now I'm taking one capsule one day and 2 capsules the next day. So the 1-2-1-2. So if your dose has to change with hydroxyurea, that is typical. I think sometimes people think they go in and think that they have to take one particular dose for the entirety of their life. Hydroxyurea, you have to work with your physician, right? And if we're trying to find the maximum tolerated dose, when I was on 3, they tried to up it to 4 just to see if I tolerated it, and I didn't tolerate it, right? And then and this is why it's important to get the counts often, right? Because now I'm on the 1-2 dose, and that's my maximum tolerated dose as of right now. So it's not, if you first get diagnosed or if you first get prescribed hydroxyurea and they prescribe you 2 capsules a day, that doesn't mean for the entirety of you taking hydroxyurea, you're going to be on 2 capsules for the entirety. Because your body changes, your dose has to change. So and dosing is very, very important within the hydroxyurea. I suspect it's a good amount of people hydroxyurea doesn't work for is because there's a dosing problem at the end of the day. And it's so important that there's companies who have like microdosing or smaller doses where they have tablets where you can break it into 4 different pieces, because that's how important dosing is for hydroxyurea. So if you have an issue with hydroxyurea, look at the dosing first, to see if it can't be fixed. Maybe it needs to be upped, maybe it needs to be down. And if it changes, that's okay. You know, that's just the journey of taking hydroxyurea at the end of the day. So I just wanted to make sure you all knew that too. It's not that, if it worked for you at 3 capsules and it stopped working at 3 capsules, that hydroxyurea doesn't work anymore. Maybe it works now better at 2 capsules in this state of, or in this place of your life, right? Weight gain, weight loss, that all affects dosing with hydroxyurea. So, um, you got to work with your doctor. This is why it's important to say, it's why they say, you have to have a doctor to prescribe you hydroxyurea and to monitor it, because this is what where the monitoring comes in, where if a dose doesn't work for you anymore, they got to adjust it. So it's not so cut and dry as I think people think it is.
And as a pediatrician, um, you were thinking about changing the dose all the time because the kids were getting bigger, they weighed more.
Yeah.
So you were always changing doses.
Yeah. To go back to and there was another question here. Are there supplements to help with hair thinning and black nails while taking hydroxyurea? Not that I know of. Supplements, and I don't think that's been studied, and it's really important to have like clinical trials or, studies for all these things, right? And so your question is very specific. Supplements that help black nails and hair thinning to those who take hydroxyurea with sickle cell. So that's a very, very specific study, and I don't think anybody's ever um, looked into that specific situation. Um, the way I make my piece, because I don't have the hair thinning, but I do have the blackening of my nails. I get my nails done. So I know it's not necessarily supplements, right? And then if my hair was thinning, I it would be sad, but it's not the deal breaker for me because I need my heart, I need my lungs, I need all my organs to live. I do not need my hair to live. I can be bald and live a happy life, and live a healthy life, right? And be bald. But I need my organs to live. And so that's kind of, even if my hair was thinning from hydroxyurea, that's something I'm willing to accept because while it's, not doing great for my hair, it's doing great for my organs and help, protect them from the damages that sickle cell causes on those organs. So, um, while there may not be supplements, hopefully that helps you think through some of this, right? And maybe hair is important to you, right? More important, and that's just a decision you have to make. But as long as you have all the information um, to make that decision, that's where I'm coming from for that. Um, we talked a little bit about this hydroxyurea causing your counts to drop because somebody asked, why does hydroxyurea cause my count? That's another adjustment that needs to be made within hydroxyurea if it's causing your counts to drop. Um, do you have a response for that particularly, Dr. Q?
Well, hydroxyurea is a medication that affects your blood counts, and that's why you have to have it checked.
Mm.
Um, and the way people, it's even though it's been around a long time, people do not know exactly the mechanism, like with biochemistry and physiology, how hydroxyurea increases your fetal hemoglobin. Um, and part of that is what people sometimes call stress erythropoiesis, that hydroxyurea somehow causes your bone marrow to be under stress, and that makes your bone marrow make more fetal hemoglobin. So that's why it affects your bone marrow, and so and the all the white cells, red cells, platelets, and that's why you need to have that monitored. And you need to have somebody who knows and reticulocyte counts are important, but somebody who knows how to interpret that so they can figure out whether or not you do actually need your dose to be changed. And then to recheck it, because sometimes if you have like perhaps a viral infection that doesn't really make you very sick, but it can decrease your counts, you need to check that again. And if they come back to normal, try to increase it back to where it was before. And I had kids in my practice, and their counts would drop. And 2 weeks later, I'd check them, and their counts would be back up. I'd start them on the same dose again, and they were fine. And I was pretty, I don't know, over the top about making sure that what I did was safe for the kids I took care of. So I would check their counts again later.
And the last follow-up question for hydroxyurea is, does it cause infertility? And we talked a little bit about that earlier. It does lower sperm count in men, but just because you have a lower sperm count doesn't make you infertile. Um, and I think it's also important to remember that sickle cell or sickling happens to all organs, and that includes reproductive organs. So sickle cell also damages those reproductive organs. And I feel like I've heard providers say that sickle cell can cause infertility too. And that's without any medications. That's just sickle cell because sickle cell doesn't discriminate organs. It'll get everything. It's an equal opportunity equal opportunist, right? So it's gonna grab your eyes, it's gonna do your ears, your reproductive organs, everything, right? And so that's the other thing. If you all are worried about hydroxyurea decreasing, sperm count, for example, sickle cell can already do that on its own without hydroxyurea. So that's another kind of like weighing out the pros and cons. Do you want sickle cell to cause infertility or cause, problems with reproductive organs, or do you want hydroxyurea to lower sperm count, right? Which doesn't stop you from, having a child. And Dr. Q said earlier, you can get off of hydroxyurea and your sperm count will go back up. So, if that's something you're thinking about in terms of family planning, you can always stop the medication to family plan, um, and then, have your child have a baby, and then, you know, get back on hydroxyurea. So, I know that's what a lot of people do at least. Anything to add to that, Dr. Q?
No, I mean, you're right. People, the sickle cell disease decrease. So men with sickle cell disease have lower sperm counts than men who don't have sickle cell disease.
Yeah.
And
I also
I
read or I also heard men with sickle cell disease have lower testosterone
they
than
can because it affects your
like 40%
testes.
lower, like
Yeah,
something
yeah,
very significant. So just like I
right.
said, sickle cell is an equal opportunist.
Yeah, and it's different for everybody, but it's probably as you get to be older, if you this is like kind of a sketchy statement, but if as you get older, your fatigue goes really down, 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 that as a male, that could be from low testosterone.
Yeah,
And
yeah.
um, you'd have to talk to your doctor, an endocrinologist to figure out whether or not getting supplements would help. Getting shots of testosterone would help.
I know somebody who does get
Yeah,
extra testosterone, and he says with sickle cell, and he says it gives him so much more energy.
yeah,
So
yep, yep,
um, that's another thing that people don't talk about, like the effects of
right,
sickle cell on your body is, hormones.
right.
Um,
So as you get older, you're going to get more tired. I can vouch for that. But if
I
but
can vouch for
as
that.
a younger guy, if you feel like, when I was 20, I had way more energy than I do now when I'm
Yeah,
30, then you should have that checked out because that
yeah,
is and testosterone is good for your whole. If you're low, testosterone is good for your whole body.
yeah.
And I don't
Oh,
think, like Cassandra's saying, people don't talk about that too much. I
yeah,
mean, but as she said, she knows someone who's getting testosterone. So there you
you
go.
do.
And the other thing is if you are chronically transfused and you're have iron overload, that will also affect your testosterone, your fertility, all that kind
Mm,
of stuff. So that's another reason. If you're on chronic transfusions, you really need to be on a chelator. And your primary care physician, if you get 10 transfusions a year, you need to make sure that you're not iron overloaded. Iron will affect your heart, your pancreas, and a lot of other organs. So if you're chronically transfused with sickle cell, you really need to make sure you're keeping that iron down. It, it's a,
Okay.
it's a common cause of death from people who are chronically transfused.
So I have a question about it says from Nigeria, I'm a footballer with sickle cell trait. I really need advice. I have crisis during matches and it's
Oh,
really affecting my career.
I'll bet. Well, one thing is you have to stay really, really hydrated. Um, and I mean, there's, it's really an active sport. I mean, you're running back and forth the field the whole time. Um, and you might have to stay hydrated and, you may have to talk with your coach or if you think you can do that to maybe space, take rest periods during a game for even if it's like 10 minutes or 15 minutes. But you really need to drink a lot of water. If you're having pain episodes or whatever during a game, it means you're right on the edge of having some really serious problems with your sickle cell trait and dehydration, which can lead to kidney failure and even death. I'm sure you're in super good shape, but there are American football players who have sickle cell trait and they're able to play football. So, to be honest with you, I think it's a lot more strenuous to play what we call soccer, than it is to play American football.
It
But
is,
but
yeah.
you really have to stay hydrated. You have to watch your diet. Um, and then if you're playing and when it's really hot somewhere, it's really important. You can really get yourself into trouble if you don't hydrate.
All right. Um, Besides drinking enough or a lot of water, what other ways can one reduce the visibility of jaundice in your eyes? I've never been on any meds and my eyes are always yellow. I understand why.
Yeah. So
Medications don't make your eyes yellow. It's
yeah,
sickle cell.
yeah. So I think, if no one's ever checked, you have to make sure that the yellow in your eyes is from hemolysis, not
Mm,
from a liver problem.
right.
So at least once during the time you have yellow eyes, if they're really yellow, somebody should just make sure that you don't have hepatitis or some other liver problem that's causing you to have yellow eyes. Then you have to do something about hemolysis. And been talking, if you've been listening to this for a while, we've been talking about a medication that can reduce hemolysis, and that's hydroxyurea. So if you have yellow eyes and you want to try to reduce that or make it go away, hydroxyurea will decrease hemolysis, and it doesn't happen overnight. It didn't occur overnight, so it takes a long time for it to go away. But that's one way of uh, trying to decrease the amount of scleral icterus or yellow eyes that you have. But it would take months and months. It wouldn't like take a week. It would take a long time. Took a long time to get there. It's going to take a long time to go away.
All right, I got a question from YouTube. Um, can a woman with sickle cell anemia Can a woman with sickle cell anemia taking hydroxyurea daily go on to have a healthy pregnancy as you age with the disease? Is it true this medication can affect your egg quality?
I don't think it affects your egg quality. Women who have sickle cell disease, just like men, it affects their testes. Women with sickle cell disease go into they stop ovulating earlier. They can go into menopause earlier than people who don't have sickle cell disease. There have been women who became pregnant while they were on hydroxyurea. And when they discovered they were pregnant, maybe they were a month or 8 weeks, or 6 to 8 weeks, something along, they would stop the hydroxyurea and their babies would be perfectly fine and healthy. Um, we recommend that you stop hydroxyurea because it's a medication that could, although no one's ever like tried to study this because it'd probably be not entirely ethical, but it could affect your child's development because it affects you. It changes your blood counts, and you have to be checked all the time. And so, of course, everything that you take goes through and it goes to the baby. So during your pregnancy, people recommend that you do not take hydroxyurea, although it's never been shown in the early part of pregnancy that people before people realized they were pregnant that affected the fetus. They had healthy babies. So yes,
All right.
give hydroxyurea a try. I mean, you if you don't try it, and you don't, then you don't know. How would you know that it makes you feel better? I mean, I'm a kind of a skeptical person. So if I had sickle cell disease, I'd at least try it just to see if it worked. And it may not work for you, but if it
Yeah.
works, hey, it's a game changer. All of a sudden you feel a lot better. And psychologically, like Cassandra, you realize, wow, I'm not going to age. My organs are going to be preserved, and I'm going to live longer. I'm going to be 60 or something, 70 even, 80 maybe.
My goal is 88.
That's my goal too.
Oh,
Yeah, you got
all
to
right.
take care of yourself. Personal disclosure. I read that somebody about my age got COVID now, like recently, so it's still out there, and they
Yeah.
didn't survive. So my
Mm,
little body ran to the doctor, and I got
yeah.
my COVID shot about a week ago because I'm like, hey,
Oh, wow.
I'm old, I don't know.
COVID's still out here in these
It's
streets,
still
guys.
there, and that's why if you have sickle cell disease and get COVID, you could get really, really deathly sick. You would be very tough.
All right. The next question I have is my mom passed at 63 years old from sickle cell disease. The autopsy states fat embolism syndrome. Can you
Mhm.
please explain how that works?
Yeah.
Please note she only had three crises in her life, and these happened when she was in her 50s after moving to New England, USA. It'd be interesting to know what type of sickle cell your mom had too. But is there an association between fat embolism
Yeah.
and sickle cell?
I'm just guessing, but she could have had hemoglobin SC disease.
That's what I was thinking too.
And one of the problems with hemoglobin SC disease is that you um, develop a syndrome where you have sickling in your bone marrow throughout your whole body, but in your bone marrow, and the bone marrow gets damaged. And there's a lot of fat in your bones, just normally, not. And so that fat gets released from your um, bone marrow, and it can cause strokes, acute chest syndrome, and it obviously, if it was really bad and uh, not treated well, it would lead to death. And sometimes, by the time you get to the doctor, you've had, the emboli have already occurred, and at that point, there's not really too much you can do about it. But yes, people who have SC disease are very susceptible to these catastrophic problems.
So if
And
I understand correctly, people with SC disease specifically store fat within their bones and
everybody does, but
Mhm.
their hemoglobin's a little bit higher, which may
Mhm.
contribute to it. But that syndrome is more common in SC disease than it is, say, in
Fat
S.
embolism is more common in SC disease.
Yeah, it can happen in anybody, but it's just more
Yeah.
common in SC.
And what actually happens? So the fat is leaking
Your
from the bones?
Yeah, your bone has the bone marrow undergoes necrosis from the or
Mm.
damage from
Yeah.
death from the sickling, and
Yeah.
that allows the fat that's in your bone marrow to be released into your bloodstream. And when that
Okay.
fat goes into your lungs or your brain, your kidneys, you have a catastrophic, it's catastrophic,
Oh,
uh, very rapid deterioration because this is all over your body. So the other thing with C disease is you can't necessarily give a transfusion because their hemoglobin's
right.
so
It's
high,
already high.
right?
Yeah.
So because of what's going on, exchange transfusion is what would you usually when things happen to people with sickle cell with SC disease, you can't transfuse. So that's the time when exchange transfusion really comes in because you remove the blood and replace the same amount. Or sometimes you even do better if you're a little bit anemic.
Yeah.
So you can't, and you can't give a simple transfusion. And you can also do like a plasma exchange or something like that. But it's catastrophic. It doesn't happen a lot, but when it does, it is usually fatal, unfortunately.
I'm so sorry to hear that happened to your
Yeah,
mom.
that's
So is
really
it, but could you say
very.
this is due to sickle cell?
Oh
It's like a
yeah.
kind of a byproduct of sickle cell, or
Mhm.
it's
I
not
mean,
a dir
it could happen to anybody, but people who have, I'm just kind of fishing in my brain to remember some of this stuff. But people like with SS, they don't have as much fat in their bone marrow. So it's unusual.
interesting.
It's unusual for people with SS, S beta zero thalassemia to have this, but for whatever reason, with SC disease, they have more fat and they tend to have this catastrophic problem more frequently than other types of sickle cell.
Yeah.
And if it's not recognized right away, if you know, if then and you don't get and sometimes you're in a place where you can't get an exchange transfusion,
Yeah.
then you'd have to do a manual exchange, or you'd have to, and it's not, I don't, it's pretty well known among sickle cell doctors, but I'm not sure if it's well known
Yeah.
among.
I wonder if your mom was being treated by a
um,
doctor who understood sickle cell and understood that that
Yeah,
was a
there's a lot of
potential.
articles about it. Even if you're a sickle cell, hematologist, and you do everything you can do, sometimes you just think, you can't do that.
I'm so sorry
It's
to hear
yeah,
that
it's
happened.
really, yeah, I can't think of anything too much worse than that for sickle cell.
All right, guys. I am going to do two more questions. So if there was a question that you didn't get answered, hurry up and put it in the chat. And I'll start us off here with ever since I had my AVN surgery, I always feel very weak. And also my other side is also on second stage of AVN. What precautions can I take for the same?
Well, AVN, if you there's not much you can do to prevent AVN once it starts. There are articles that came from where I practiced in Oakland, that physical therapy with AVN can decrease the pain and prolong the time between when you have pain and when you get your hip replacement. And during that time, you're doing better because you don't have as much pain. But once AVN starts, it's very difficult to kind of arrest it. And the physical therapy can do that, but it's not permanent. It's not like you do physical therapy and you're not going to have AVN, it's just going to go away. Um, and unfortunately, a lot of people have bilateral hip replacements.
Yeah.
So um, if you've had one, then you realize once you have your hip replacement, like Cassandra says, you've got metal in there, so you still have pain and stuff like that. But it's way different than having AVM.
Yeah.
Uh,
So, this person said they always feel weak
uh,
after the surgery. Is it because could it be something of surrounding recovery or like a delayed recovery?
It depends on how long it's been, but after any kind of surgery, you're going to feel kind of weak and tired for a while because you usually with hip replacements, you're out of bed the next day, right?
Yeah,
They
they
don't they
don't
don't
let you
they
rest.
don't let you lay around. But if you once you're out of the hospital, if your activity level goes down because you're having some residual pain in your hip, then you are deconditioned, and that makes you tired and weak, and you can't do the things that you used to be able to do before you had the AVN. That could be it. And what you need to do in that case is get your primary care provider to get you into physical therapy, and they can figure out a plan for you to gradually increase your activity to get you back to your normal self.
Yeah. All right, guys, I have my last question,
Oh
and
no.
I know, right? And then we'll have Dr. Q share his
So
special sentiment
my special sign off.
and sign off here. The last question I have here is I'm trying to pin it here. My 6-year-old son has sickle hemoglobin C, so SE, takes folic acid every day. What else can I give him in terms of vitamins?
uh I'm just thinking. I mean, if your son had and well if your family has a really good diet and you eat the kind of what some people call a Mediterranean diet where you're eating a lot of vegetables, you're eating salads, you're eating chicken and not red meat too much, um, then you're going to get all the vitamins you really need. People give folic acid because it helps uh, increase your blood count, although there have been studies to show that, at least in this country, you don't need to take folic acid because all grains are fortified with folic acid. Um, so I think just like with everybody else who has sickle cell disease, your diet is way more important than it is for other people. You are what you eat. And if you have sickle cell disease, you really have to have a good diet. And you have to, don't drink alcohol, don't drink too much coffee. Those are diuretics and they'll make you sick. Um, and for children, I think it's just giving them a good diet and not letting them eat too much junk food like candy, what people call ultra processed foods.
Yeah.
If you cook at home, that is the best, going to some
Using
fast,
fresh whole ingredients.
yeah, and going to fast food places are kind of fun and all that, but the nutrition there is not what you would get if you cooked at home. Just ask your
Yeah.
mom. She'll tell you.
My mom will
Really.
tell you. Okay.
So
So a healthy diet is important for those who live with sickle cell, and getting started early is even more important too. So your son is 6 years old. That's the perfect time to, you know, set precedents for the rest of his life and how he should eat. But yeah, nutrition is important for sickle cell. So
Yep.
don't discount that. While it can help alleviate some of the, extra stuff that we might go through with sickle cell. So, um, definitely an important question to be asking.
And for kids, you have to have exercise as well. Children with they
Yeah.
have to hydrate really well. Like we were talking about a football player in I guess was in Nigeria. You have to hydrate really well, no matter what kind of sickle cell you have. But kids should be able to do basketball, sports, to whatever they can handle. Don't push them into sports, but as long as they're hydrating really well, they need to get some exercise. And if you have SC, if you have SS or S beta zero, of course your hemoglobin is going to be low, so you're going to run out of steam before other people do. And just since we're talking about there's a 504 plan and things like this at school where your child can have water in the classroom, can get breaks to go to the bathroom, and doesn't have to run a mile like all the rest of the kids in school. And that's really important. PE teachers, in my experience, they want everybody out there running a mile. Whether you have sickle cell, it doesn't bother them, but it bothers you. So you need to have a 504 plan in order to accommodate your child at school. And that's in the United States. The other
Yeah.
countries, I don't know what they do. Okay.
All right, guys. So sorry, I'm sleepy today. Like I haven't had my Dr. Q is talking about not having coffee, and I'm like, I haven't had my coffee. Do what did I
Well, if you
say?
take
Not
your
at
if you
all.
drink that coffee, drink a
Coffee
lot of
just came.
water.
Thanks, Boo. Um, thank you guys so
Uh,
much for the wonderful questions. This is always
yeah,
amazing to get to chat with you and to hear some of your
yeah,
concerns, right? And to kind of figure this out together. So appreciate that.
yeah.
I'll hand it over to Dr. Q for his statement.
Okay, so if your question didn't get answered or you have another question that comes up, you can always ask Dr. Q at Sickle Cell 101, or ask the expert, I guess it's called, although I don't know if I'm really an expert. But anyway, um, this Sickle Cell 101 is for information only. Knowledge is power. So we are here to give you information. We're not here, and I'm not here to try to tell you to take any kind of particular medication, to do any kind of treatment, to do anything. You got to I'm giving advice. I'm not giving medical advice. I'm just giving you the kind of advice you'd get from your mother if she was had gone to medical school.
There you go.
Uh, and so that's my disclaimer. This is information only. We're not really trying to uh, give you medical advice. But with that information, and knowledge is power, then if you know a lot about your sickle cell disease, then you can advocate for yourself, which is really, really important. If you know about your disease and you can go to the emergency room and tell somebody, what do you mean? How long have I had sickle cell disease? Do you know anything? So, yes, knowledge is very important with
I feel like that
chronic.
should be our tagline closing off of this. Knowledge is power.
Yeah, it is. I mean, that's like that's what we used to say in the 60s. So there you go.
I know. Let's bring it
Yeah.
back. Let's
Yeah,
bring
let's
it
bring it
back.
back.
Knowledge is power.
Yeah.
All right. If like Dr. Q said, if you didn't get your question answered, please feel free to send it in to ask@sc101.org and it'll get answered. Thank you all so much for joining us this Friday. Oh, hi. Zara. Zara, come see Ruby. Hurry, hurry, hurry.
So this is my little
Oh,
granddaughter. There you go, sweetheart.
wait, one more time, Dr. Q.
Oh, here.
So we're showing off our family, guys. Oh, she's so cute. Hi.
So
Earlier, my daughter
so
was asking to see.
so
Uh,
I got a little note. Dear Grampy, we have to leave soon to get Calvin, her brother.
oh. All right. Well, you guys have
Okay.
a blessed weekend. Take care. Be good to yourself. Make sure you get your rest in, the extra Z's, and we will see you next time. Thank you guys so much.
Bye bye, everybody. Thank you.
Bye.